First, I want to thank Senator Whitehouse for his partnership. As he said, for the last few years, we've been working on this issue, ensuring that we have a comprehensive approach to this horrible issue of drug addiction, specifically the increasing threat we see in all of our communities to addiction to prescription drugs and heroin. It is the #1 cause of death now in my home state of Ohio, and we're told that the #1 cause of accidental death in the country now is overdoses. But it's far worse than that. It's tearing apart families and communities, and we do need to address it. I will say two things. One, this is not just a bill about principles, this is a bill about policy. So what we're supporting, what Senator Whitehouse is supporting, is new policies to approach this more effectively as to prevention and education, evidence-based, as to treatment and recovery, as to dealing with the unfortunate situation of too many overdoses of naloxone and training, as to getting prescription drug monitoring programs in place, as to helping these addicted babies and these mothers who are pregnant and have an addiction. So there's very specific policy changes here that direct the increase in appropriations which was provided this year for the current fiscal year, for the next 7-8 months. And so that funding will be there for this. If we were to pass this bill tomorrow and get it enacted into law, that funding would be there, not just on principles, but on specific ways to spend that money more effectively. I want to make that point clear. Second, I do support additional resources, as does Senator Whitehouse. I think this is such a crisis that it requires resources over and above what we've provided for, even in CARA, as important as it is. But we've got to get CARA done, and I agree with Senator Whitehouse on that. This is our #1 priority, not just of us, but 130 groups around the country who are the people who are the experts in prevention and education, treatment and recovery, and they have come together and given us their best counsel, and that is that this legislation will actually help to begin to reverse this terrible trend of addiction. So I'm hopeful that we can have a full debate on this. Senator Shaheen is going to offer, as I understand, an amendment. I've just seen the revised version of her amendment. I believe I will be able to support that amendment. I've just started to look at it, but I like it because it does provide additional funding. But it's in addition to the funding that we know is already going to be there for CARA. It would be emergency funding, and it's not usual for me to support emergency funding that's not paid for through other offsets. But I think we are in such a crisis in this country right now, and including in my state, that I will be able to support that. However, as Senator Whitehouse said, we have to pass the underlying bill. And I appreciate his commitment to that, as is the commitment of so many other great groups around the country who have supported us and said, let's not get off track here. Let's get this legislation passed. We have companion legislation in the House. It's bipartisan. It's identical to the legislation that Senator Whitehouse and I introduced. Identical. We worked together with the House on this. It's bipartisan. They have over 88 co-sponsors, Republican and Democrat. And we have some very good signals from the White House, of course, that they're interested in working with us. Therefore, this can actually get done. And it's not just about this year and funding for this year. Obviously, this would be a change in the way we spend money. It's an authorization, changing it for next year and the year after and the year after. And in my experience, that's what needs to be done. I was the author of the Drug-Free Communities Act in the House. Over the past almost 2 decades, there's now been $1.3 billion spent under the auspices of the Drug-Free Communities Act that directs and targets that funding to what we know is effective prevention. Our legislation takes that the next step further, by the way, with regard to heroin and prescription drugs to help those communities that are particularly impacted. So I thank my colleague from Rhode Island and my colleague from Virginia. Thank you for your indulgence. Sorry to interrupt you in the beginning of your colloquy with colleagues. And, Mr. President, I yield my time.